So good morning and or good afternoon to all, and welcome to this panel discussion of the African Water Association. I would first like to thank you for taking some of your time to participate in this panel discussion, which the topic is how water and sanitation utilities in Africa operate facing the COVID-19 pandemic. And I thank you also for posting many questions on the subject when you registered. We are going to try to answer. We will try to answer throughout this discussion. And I'd also like to remind you that you can, while the discussion is going on, continue to ask a question by clicking the Q&R button at the bottom of your screen or making comments on the chat to the right of your screen. I am Sylvan Usher, Executive Director of the African Water Association, which is an international organization that brings together all African drinking water and sanitation companies, which was established in 1980 to promote the setting of an experience sharing and capacity building platform for the continent's water and sanitation services in order to constantly improve their performance and increase access to clean water and sanitation services to the African population. I would also like to thank today's panelists, all leaders of water and sanitation companies in Africa, who were willing to take some of their time to share their experience in the current global situation that is caused by the COVID-19. Since the beginning of 2020, the disease of the COVID-19 virus initially appeared in China at the end of 2019 has gone from epidemic to pandemic at the global level. This has created an unprecedented health situation, but also a very largely disrupted environment due, of course, to the number of fast and very large scale infection in which has forced government to take crisis management measures that affect a significant part of the world population. The water and sanitation sector is particularly affected by direct or indirect impact from this situation. Frequent hand wash with soap and water is, according to the WHO, the ultimate barrier to slowing the progress of the pandemic. But when we know that according to the WHO statistic, 3 billion people, let's say 40% of the world population, and 72% of the population of the least developed countries do not have access to hand washing devices with soap at home. This situation normally leads to the death of 800,000 people a year and 1,000 children under 5 years old of age per day due to diseases related to dirty water and lack of hygiene. In the context of the current health crisis, the lack of water and sanitation is clearly a factor of exacerbating the contagion. Water professionals are essential for public health. So how the water and sanitation services in Africa are facing this COVID-19 pandemic, especially when people are facing partial or total containment, or when the government decides to defer payment of water and sanitation bills. Water and sanitation service had to readjust their organization to deal with the COVID-19 pandemic. Among the issues, ensuring the availability of inventory, reactive spare part, etc., which means continuing to have access to financial resources, tariffs, taxes, transfer. Service operator must reorganize their human resources by ensuring their protection, work from home for some, or in the field for others. What should be the role of the water professionals in the COVID-19 pandemic in Africa? At this time, water and sanitation service are key elements in the fight against the spread of the pandemic, providing essential services, especially in lockdown situation. They are the first rampart against the disease, the necessary condition for the operation of the service must be safeguarded. So, to shed light on this issue, we have 5 panelists from Kenya, Uganda, South Africa, Malawi, and Ghana. And they are taking part in this exercise to answer 5 of the questions that I will be posing them. So now the first question that we'll be dealing with after hearing this context is how the management of the companies is carried out under the current condition of the fight against spread of COVID-19. And I will ask the first panelist to respond to this question. And the first panelist is Engineer Lucy Njambi, Engineer Lucy Njambi. And Engineer Lucy Njambi is graduated from Nairobi University with a Bachelor in Civil Engineering in 1988 and mastered in Water and Sanitation from Temple University. She is registered as an engineer with the Engineering Registration Board of Kenya and member of the Institution of Engineers. She worked in the Department of Water in Nairobi City Council and later as a manager in various department categories in Nairobi Water and Sewage Company. She is currently the technical director in the company, and she has over 25 years experience in design, operation, maintenance of water and sewage work. Nairobi City Water and Sewage Company is a water service provider serving 5 million people with water and sanitation services. Nairobi is the sole service provider in the city of Nairobi, and the company is wholly owned by the county of Nairobi. The demand of water is 780,000 cubic meters. And Engineer Lucy Njambi, you have the word. Actually, it looks like she disappeared. Yes, please. Lucy, you have the word. Can you answer the question?
Okay, thank you. Thank you, Asha. Thank you. As you're told, my name is Engineer Lucy Njambi, and I'm the acting technical director in Nairobi City. My boss was not available today because he's commissioning some boreholes. And yes, so in this COVID time, I just want to say, I give a very small brief of Nairobi. Nairobi City has got about 4.8 million people, and the demand for water is about 780,000 meters cubed per day, and we are able to supply 525,000 meters cubed per day. So we have quite a deficit under normal circumstances. The other special feature about Nairobi is that it's a compact city. It is not a big city, so most people, there is a lot of flats, a lot of crowding in the city because it's a small city. So with the COVID-19 coming, Nairobi has a special problem because the population densities can be very high in some areas. They can go as high as 10,000 persons per square hectare. So with COVID-19, the first thing that the government did in liaison with Nairobi, using Nairobi as the agent, is to ensure that there is water for hand washing. So the first big project we had, immediately we got the first cases in Nairobi, is to ensure that there is hand washing, massive hand washing. So we within 2 weeks, we put 1,200 people. So this puts our task, because they have to go everywhere doing the work, and yet the work had to be done. So that was the first project that had to be done very quickly. And the second project that also was done, tanks, water tanks. This, we did about 60 of them, so as to ensure that the hand washing points have got water. And we also had a project to also ensure that there's soap And we continued this, and we used to work day and night. Our staff were working day and night to ensure there's enough water, because it was important to contain the situation. And then after that, there has been subsequent several other projects that we are doing. We are drilling boreholes in the city. We have already drilled 20 in the last 3 weeks. And also we are drilling.
A bit of technical issues with Lucy. Okay. Good. Listen, until Lucy probably come back, probably we can go to the second question. Well, the second panelist, and this would be Mahmoud Lutaya from Uganda, a National Water and Sewage Corporation. Mahmoud Lutaya is an engineer with broad working experience in water utility operation. He works in institutional development, strategic and investment planning, performance management, incentive-based contract and project management, and water utility management. He is currently the general manager of Kampala Water, the biggest operation area of National Water and Sewage Corporation that constitute over 60% of national water and sewage operation, and also covers Uganda's capital city, Kampala. He is a member of ofthe Strategic Committee and also a member of International Water Association Strategic Committee. The National Water and Sewage Corporation Uganda is a public utility company completely owned by the government of Uganda, established in 1972. The corporation mandate is to operate and provide water and sewage service in the areas entrusted to it on a sound commercial and financially viable basis. Mahmoud, can you answer the question, please? How the management of company is carried out under the current condition? You have the word.
Okay, thank you, Usha. First of all, I would like to thank African Water Association for this initiative, especially at the time where we need to learn from each other to fight this pandemic. First of all, I would like to provide, I think, an overview highlights of the COVID situation in Uganda for the context of my presentation. In Uganda, we registered our first COVID patient. That was around 21st March. And as I talk now, we have 81 confirmed cases of patients with COVID. We've also registered 52 people who have recovered, and we haven't registered anyone dying. So we've had a very strong leadership at all levels. His Excellency, the President of Uganda, with guidance from the Minister of Health and other government agencies, has given a number of directives and guidelines on how we prevent and also respond to the spread of the virus. So a number of directives have been issued and guidelines, and some of them you can see them. There have been a total lockdown on operation. There's been closure of non-food businesses. We've had closure of freezing of public and private transport. We have a curfew every day from 7 p.m. to 6:30 every morning. And this has definitely affected the way we operate. But water, national water in particular, is one of the essential services. So we've continued to operate, though we've been operating under a very constrained and challenging situation. Now, our ability to continue operating again under these challenges has been down to the strong leadership we have within the organization, from the board and also the management. Our MD, Dr. Engineer Silva Mugisha, has been at the forefront of engaging the different stakeholders, from government to the public, to the customers, and also the staff on the continuous basis, basically in as far as our preparedness as an institution is concerned during this period, and also mobilizing support for our programs to make sure that people receive water. So from the onset, what we had to do as an organization was to make sure that we activate our business continuity and emergency response plan. So we had to make sure that we have all the inputs we need to guarantee uninterrupted supply to water to our customers. So that one, we had to make sure that it was available. We had to establish rapid response teams so that in case of any interruptions in supply, we're able to respond to it within the shortest time possible. So we have rapid response teams across the different operation areas. What also we had to do is right now we have been focusing on prioritizing the safety and the protection of our staff. So what we have basically is we had to make sure that our staff and also our premises are secure. We have tried to decongest our operations. We have had to allow some of our staff to work from home. Some are working shifts. What I can say right now, we're working with the half of our staff complements. We have secured and protected our premises for those staff that are working. We have installed hand washing facilities and sanitation facilities. One interesting thing is that internally we are producing our sanitizers as an organization as a way to bring down the cost of running the business. Our staff have been equipped with all the protective gear so that they are protected, but most importantly, we've also educated them when they go out to the field, they are able to observe the minimum standard operating procedures. What we've also done is to make sure that in this period of social distancing, we are promoting more of contactless services. So what we are doing, what we're encouraging our customers is utilizing our contactless services, utilizing our 24-hour call center where we have a toll-free line. We are utilizing our mobile app and also our online services, the social media platforms. The idea is that the customers are still able to receive the same services through those platforms like they would receive when they come to our offices. Now, the government and the president gave a directive. During this period, there's no disconnection. It's considered completely unhuman to disconnect people in a time where they need the service more. So what we've tried to do as an organization is to engage more the customers on the different platforms for them to appreciate why it is important for them to still pay the services under the current situation. So we've done a lot of massive engagement through the social media, through the different digital platforms, trying to appreciate or make the customers and the public appreciate that water is very important, but also it's a service that they have to pay for. Now we have customers that are originally disconnected from the system. What we've tried to do also is to make sure that we waive off any charges that they need to pay for. So we encourage them to come back onto supply. They just need to call us and we have our teams going out there in the field to make sure that they are reconnected. Now we have partnered with the Kampala City Authority, Kampala KCCA, and we installed hand washing points in strategic and highly congested places within the city, especially in markets and also taxi parks when they were still open and other places. So the idea is that the public is still able to practice hand washing without any interruption. The other partnership we've had is we partnered with the private sector. We've partnered with MTN Uganda, which is a telecom company. We partnered with Roofings, which is a manufacturer of pipes, and also Sojia Satom, one of our contractors. And we're installing public water points in areas across the city that are right now water stressed. So these public water points are equipped with a storage tank facility, and we're able to provide water in those places. Where we have challenges, we also got a water bowser, and we're able to take water to those places. I think the point is to make sure that in this period when people need water, everyone is able to have access to this water.
Thank you. Thank you very much, Mahmoud, for this presentation. Now, the same question is asked to Mr. Moses Mwenye from Lilongwe. Mr. Moses Mwenye is a management specialist and has worked before in various managerial positions in the public service, such as Registrar at Polytechnic, a constituent college of the University of Malawi, Director of Administration and Human Resources at Covert Authority, among others. And Mr. Moses joined Lilongwe Water as Director of Corporate Service in 2018 and later became acting chief executive officer in December 2019. Lilongwe Water is a utility established in 1947 and reconstituted by the Waterworks Act in 1995, with mandate to supply water to the city of Lilongwe and its surrounding peri-urban area. It is currently serving a population of about 1 million people with 83% coverage. Moses Menwe, Director of Lilongwe, please, you have the word.
Thank you very much, Asha, and all colleagues. Welcome. And for Lilongwe Water Board, we are actually doing everything possible that we can do in this COVID situation. First of all, just to acknowledge that the government of Malawi is doing the best that it can do to contain the COVID-19. Perhaps just to appreciate some statistics at that higher level. So far, we have, as a country, 37 cases that have been confirmed. And out of the 37 cases, 5 have recovered and 3 have passed on. So statistically at national level, that's the situation, a total of 37 cases so far. And so every time on daily basis, government is actually giving updates on the various new cases that are coming out. Coming to Lilongwe Water Board, we are an essential service, and being an essential service, we actually are working, except that within the essential service, we have prioritized those that are really essential. So members of staff that are in the production and distribution department are actually working the way they have normally been working. But the rest of the other departments, namely finance, IT, human resource, administration, and all other departments of that nature, these ones are working in shifts. What we have done is to put them into 3 weekly shifts, so much so that you have a team that comes this week, and then it goes, another team comes the other week, and the third team comes the third week. So they are actually working for one week, and they are resting for the next 2 weeks, and that's how we are managing. I must say that apart from the shift working, we have also allowed members of staff that have loans with the organization, and they do not want to be deducted, to enjoy the non-deduction for a period of 3 months. So for a period of 3 months, beginning this month, members of staff that do not want their loans deducted so that they have adequate income to contain the virus, we have allowed them that leeway. And again, what we have also done is to procure for members of staff sanitizers. We have procured masks for them, and we are actually in the process of procuring hand washing equipment. That's hand washing buckets and basins. These will be used not only at the offices but in the city of Lilongwe. We will also identify places where we can place these ones. We are in that regard working hand in hand with the Lilongwe City Council, and so in the strategic places we are going to place these ones. May I also just mention that we are also having very good cooperation from our donors and the other stakeholders and partners. For instance, we are about to receive a donation from Tibet of India. This is a donation that is going to have masks, sanitizers, and as well as equipment that will be used for measuring temperature. These are temperature scanners. Yeah. So we are expecting this any day in the country. And already we have also been given some finances by the World Bank so that we can also manage the pandemic. And one of the things that we are going to do is to buy an extra water bowser. We have currently 3 water bowsers, so we are going to add a 4th water bowser so that in places where there's acute shortage of water, we then can just supplement the supply. Beyond that, we are no longer disconnecting overdue accounts. What we are doing is to just talk to the customers. We are sending them just notifications of their overdue accounts, but not necessarily disconnecting. Of course, the result has been that we are challenged in terms of revenue collection. You know, some customers wouldn't come and pay unless there is threat for disconnection. But all the same, we're encouraging them to pay their bills through the various platforms that are there. And in addition, again, we also have various platforms, payments through the banks, through Airtel Money, and the other technological means. And also the beauty being that in a number of institutions, we installed the prepaid meters, and therefore that I think is cushioning our revenue base. But for the postpaid customers, we are actually struggling to have them pay because we are no longer making disconnections. So in brief, I would say that's how we are managing the pandemic, and we will continue operating in this mode up until the situation improves. Thank you.
Thank you. Thank you very much, Moses. Our next panelist is Dr. Brame Clifford from Ghana. And the question, because some participants required to reset the question, which is, how is the management of the company carried out under the current condition of the fight against the spread of COVID-19? Dr. Brame Clifford has a PhD in water supply management and also from Covert University. Before joining Ghana Water and Ghana Water and Company Limited, he was senior lecturer and dean of school engineering at Tamale Technical University. His area of interest in the water supply sector include performance management and training. He has executed performance audit of some water supply system in Ghana during his professional life. And Dr. Brame Clifford joined Ghana Water Company on 27 March 2017 as managing director. Ghana Water Company Limited is established in July 1999 after going through series of reform since 1928. Is responsible for water supply to urban population and industry in Ghana and currently covering more than 70% of the population. Doctor, can you please tell us a bit on the situation in Accra in Ghana, let's say?
Thank you very much, Asha, and thank you very much, my colleagues, for your presentation. For us in Ghana Water Company, management of our systems, in a way, has been a little bit altered by the Covert program because we started having experience of Covert in Ghana in somewhere March, and the president had to give directives as how work is supposed to be done, and we are the essential service. We are supposed to be working. There was a lockdown in the country. We have to still make sure we put our acts together. The president has also indicated that from April to June, for 3 months, there shouldn't be any disconnection in the process, and people should have water for free, and Ghana Water Company should ensure that all the areas that are distressed are covered. And so as a company, we needed to follow some of the directives the president has given, where we have to show some social distancing and then also make sure that there is no crowd. So the company had to reduce its workforce. We had to ask staff who are not critical at this time to come to office on a rotational basis. Every 2 weeks, you come and then you stay off home for another 2 weeks. Also, we indicated that staff that have underlying sicknesses that could have problems in case they are affected can take their annual leave and stay home and then make sure they don't come into contact with anybody who's affected. We also try as much as possible as a company not to get our meter readers get into homes, because we still have to physically go and read our meters. And so we asked that we're going to use the 3-month average of every customer to bill them going forward, so that anytime the situation regularizes, we then balance up by the real readings of the meters. But unfortunately, since the president said we should give Ghanaians free water, we actually need to get the real numbers, because that is what the government will be paying for. Because if you give them free water, the bill is given to the states for the states to pay for it for us. And so we've indicated that now the staff can go to the homes, but we've provided them with personal protective equipment where they wear masks, they have some shield on their faces so that they can get into the homes, and they still also have to observe the social distancing so that they don't get into contact with people to transfer the disease to the people if they have one. Our laboratories have also been tasked to manufacture the sanitizers. And so we're doing a lot of them. All our laboratories across the country are manufacturing the sanitizers for staff. Yesterday we had to donate a number of cartons of them to a hospital in the central part of Ghana as part of our social corporate responsibilities. And so the sanitizers that we use are not only for us, we also try to let our customers also have them. And once the president has indicated that people should have water, we also had to get tanks in our distressed areas as a company. And so we had to purchase 10,000 liters water containers and put them across the whole Ghana in areas where they are distressed. And then arrange with the tanker services operators to fill those tanks regularly at the cost of the company. So the company is going to pay the tanker service people to really supply water to the individual. Then the bill is also transferred to the state for payment. And so a lot of things have changed as far as our management of the company is concerned. Our technical staff still go on the field to do what they are supposed to be doing. And so for them, we just have to monitor and make sure that they still follow the protocols that are required as every Ghanaian that will do whilst they are doing their work on the field. Stand pipes will have to be constructed where they are actually not available, so that people can have access to free water that the states want people to have. We've also taken advantage of technology to be able to manage the company away from office, so that we don't crowd the offices. And so we do most of our meetings, management meetings, on the Microsoft Teams, and make sure that people still are abreast with what we do. We always have our meetings with our regulators and then our partners all online, and we don't actually meet physically, to ensure that we still have also help to protect our people. And I think for now, that's how we are trying to manage the company to ensure that nothing happens. And we've also made it a policy that you can't enter any of our premises if you are not in a mask. And I'm sure when we get to the other side, we'll mention that. Thank you very much.
Thank you very much, Dr. Now we have the last panelist for the first question, and this is Professor Amance Kassan from Rainwater. Professor Amance Kassan has over 30 years of experience, both academic and practitioner. Very active on continental and global basis, working with many organizations in the sector. He currently serves on the board of ofthe, an International Water Association also. Professor Amance Kassan is the General Manager of Scientific Service at Rainwater, South Africa, and is also the chair of the COVID task team of Rainwater. Rainwater is the largest public water utility in Africa and one of the largest worldwide, producing potable water of high quality at affordable price, 24 hours, 7 days, in the economic hub of Africa for 16 million people. Since the COVID outbreak, the Minister of Water and Sanitation has established the National Command Center for Water at Rainwater to focus on water delivery on national basis. Professor Amance, you have the word.
Thank you very much, Salvain. Really delighted to be here. Good afternoon, or whatever time suits all of our colleagues. I see there's about 119 participants. Wow, this is really exciting. Let me start by giving you what the picture of the COVID virus situation in South Africa is very quickly. We currently have 5,350 positive cases. We have tested around 197,000 people, which is equal to around 0.35% of our population. And we have, sadly, 103 deaths. We have 9 provinces in the country. Some provinces are more impacted than less provinces, and it's an interesting pattern that is changing. Almost on a weekly basis, the trends change. So South Africa has been in a lockdown announced by the president. The president is a very strong proponent, leading from the front on the onslaught against this pandemic. We had a lockdown initially for 3 weeks, which was extended by 2 weeks. So today, it's fortuitous that the 5 weeks of the lockdown ends today. However, this does not mean that the lockdown is over. We are now moving from what we call phase 5 or level 5 lockdown to level 4. This means that we will still only have essential services staff going to work. We will not have an opening up of the entire industry. South Africa has now created 5 levels of risk from 5, 4, 3, 2, 1. And it's very clear which industries will open at which level. Now, this virus having happened, with us having been in lockdown now for 5 weeks already, we now, as my other colleagues have indicated, what is being promoted from the very beginning is hand washing, use of sanitizers, use of masks, gloves, etc. The difference as we go into a phase 4 lockdown from tomorrow is that screening, temperature screening of employees will now be mandatory. All employees will be screened for the temperature and for the history around the COVID virus, etc. Regulations are being formulated every few days in terms of providing direction by the Department of Health, the National Institute of Communicable Diseases, etc. This is the country picture I'd like to paint. Of course, social distancing has been exercised and is being promoted. We cannot have in any event more than 50 people. Even a funeral is restricted to 50 people. No international travel, no provincial travel without a reason, like, for example, going to a funeral. That's the country situation. How is Rainwater dealing with the situation as a water utility? Of course, we know that the COVID virus is not waterborne. In other words, it's not a virus that comes through and transmitted through water. However, water is a key link because we require water to drink and, most importantly, to wash our hands with soap to keep the virus away from us. So there are 2 aspects that Rainwater has looked at. We firstly activated the Joint Operations Committee, which is comprised of all stakeholders in the business. The CEO is a front runner of this. He's been very active, as indicated by my Ugandan colleague, in terms of communication. Having activated the Joint Operations Committee, we immediately set in place a Covert task group. This is the task group that is chaired by myself, which now looks at every risk presented to rainwater on two fronts. There are two key issues when it comes to the virus and water utilities that we've learned. The first thing is to sustain the water supply and the operations of your business. Now, given that the virus is not transmitted through water, we have now put steps in place to ensure that the water treatment process, and in particular the disinfection process, is conducted in a way to ensure that the virus is never transmitted through water, because the international literature does show that it survives in the wastewater for some hours. Having put that in place and ensuring adequate water supply on the one hand, the second issue is the protection of staff. And we are a labor-intensive business. We require our staff in order to operate the plants, etc. So from the beginning of the lockdown, we have asked all non-essential services staff to work from home. They do not have to take vacation leave. They are fully capacitated with laptops, with the appropriate equipment to work from home, to work remotely, to continue to undertake their function. So in that way, we've almost reduced, for example, at the head office, the staff complement by 80 to 85%. We have lesser people around, we are disinfecting all the buildings, we're ensuring that all staff have the protective equipment. Now, having assured the staff with all of these resources, there's still a lot of work that one has to do as a water utility. Inventory management, I'd like to raise, is key. One has to think very carefully about your source of chemicals, your source of some of your hardware and your infrastructure, and how you would cope with this period of time, maintaining contact with suppliers, because suppliers may well be closed as well in certain industries. The other issue is the notion of masks. Now, there are many masks available on the market, and when the demand is high, the supply is low. So our experience is that you need to insist on material safety data sheets, because the findings in the world are, in China, they found that there's some 90 million masks that were manufactured that do not offer any protection whatsoever. So colleagues, we need to be cautious about this. Customer relationship is key. We are keeping in touch with our customers. We are keeping in touch with our staff so that they're assured of what the situation is. Demand management, I know, is an issue that has been flagged. Are we able to supply sufficient amount of water? Well, on the positive side, given the lockdown, the demand has reduced because industries are closed and some of the big users are not using that water. However, people are using more water to wash their hands. But we are managing to supply, as we would normally supply, in the region of 4,800 million liters per day. So water supply is there. But interestingly, the Minister of Water, as Sylvain had indicated, established the National Command Center for Water in rainwater to take care of water sustainability in South Africa. This project has been running for a month. We have mobilized, procured and mobilized 1,300 water tankers through 9 provinces now. We have mobilized 1,900 water tanks for the tankers to fill water into the tanks. I noted there was a question in the chat session on water quality. Yes, we have put in a water quality program to monitor the quality of water from source to tank, through truck, on the way, etc., to ensure that people are not getting sick by using this water. So in essence, Chair, we are doing the best that we can. There are very difficult circumstances, and indeed, I don't believe that water utilities will be run the same again after this enormous experience that we're going through. Thank you very much for that opportunity.
Thank you very much, Prof. What you just said at the end is a question that will be coming at the end of the session, so you'll be happy to respond on that. Thank you very much for this first question. I will go directly to the second question because of sake of time. And the context of the second question is the following. One of the most important barrier measures is frequent hand washing. This certainly has an impact on consumption, including the fact that government have asked to suspend collection of bills for now, thus depriving you companies from financial resources and certainly to reopen households whose supplies were interrupted before the COVID-19 world crisis. So the question is, what is the comportment of the level of consumption? Can it be satisfied in your various companies? And how do you plan to collect the invoices that will be issued later? So first of all, Professor, you had the last word. I will give you the first word again. So what is your answer on this? Your mic, Professor, your mic.
Yes, thank you very much, Sylvain. The answer is simple. In our case, as a bulk water utility, the use of additional water for hand washing is not having a major impact on water demand. And particularly with the lockdown, as I said, that was in our favor in terms of water utilization. However, I should say that for the communities that do not have access to water, we have mobilized the tankers and the tanks to ensure that people have water. At the same time, any unpaid water bills are not being dealt with at this point in time because the supply of water is more important than anything else in order to overcome this disease at this point in time. Thank you very much.
Thank you very much. Dr. Clifford Bremer, please, from Ghana Water.
Thank you very much. For us in Ghana, we are supposed to give free water for 3 months. That is April, May, and June. And so we had put in a COVID committee, Ghana Water Company COVID-19 team, starting from the national level. We have it at the regional level, then we have it at the district level. And so areas where we don't have water, that's where we put in the tanks, where the tankers will supply the water according to our standards. And the bills for our domestic customers is supposed to be absorbed by government. So we don't have a challenge where we find it difficult to get the resources. And I must say that for our April bills, the Ministry of Finance has already made it available for Ghana Water Company to have, so that we'll be able to use. So we've had serious discussions with the Ministry of Finance and government, and then they have taken it on board. But the issue that we need to indicate is that because it's free, and a lot of people who otherwise wouldn't have used water for 1 or 2 domestic things will use the water. So what we have noticed already is that between January and March, there has been an increase of 11%. And just March and then April, we are anticipating that there will be an additional 10% increase. And so the company has already made all these scenarios, and we are in the position to supply whatever that we need to supply to our people. So I don't think we have any serious challenge for us to be able to do that. The other thing is for collection of the payment for the domestic ones. Some are still using our electronic platforms, and so to make the payment to us through the mobile money, they use Express Pay, they use Slide Pay, and some of them are using the banks to actually get our money into our account, so that we still don't get direct contact with them. So we'll give out the water, and we are sure to be able to collect the invoices that we send out.
Thank you, Doctor. Modest from Lilongwe.
Thank you. Certainly, the consumption is likely going to be high. We are yet to make a measurement because I think for us, I could say that April perhaps has been the month when I think we have taken serious measures and steps towards COVID-19. So we should be able to make measurement, but certainly when you observe around the usage of water has increased, which means even in terms of the bills, they would have to also go up, and that we are no longer disconnecting, that is likely going to be a challenge. So As a company, we continue to do meter reading. So we are doing the meter reading, we are delivering the bills, and we are advising customers to use online platforms of paying. But I think I must mention that it is really not going to be easy to collect from the invoices and the bills that are going to be issued now, because I think people are going to accumulate huge bills, especially that we are not disconnecting. Thank you.
Thank you very much. Thank you very much. Dr. Mahmoud Lutaya.
Yes, thank you. A bit similar in our case, I think with the lockdown, the demand in some of the other customer categories has gone up. So basically, water supply is adequate. We have a few sections in the network where we have infrastructure challenges. Those ones we are providing the water tanks. Now, the government didn't suspend payment of bills in the case of Uganda, suspended the disconnection. So like I said, we've tried to do a lot of engagement with the customers, try to sensitize them on the value and why it's very important, even during these tough times, for them to pay their water bill so that the bills don't accumulate. And it's very interesting. And again, this is the revelation that is coming out again, that sometimes even without disconnection, some people are still able to pay. Last month, we were able to collect, say, 90% of the bills that we had sent out. This month is a bit more challenging. We expect to get around 50% of what we're able to bill. So the point is that we're talking about business transformation. It means that people are able to pay without disconnection if you're effectively engaging them. Now, regarding the accumulated bills, I think once this situation is over, we'll have to go into flexible repayment arrangements with each customer depending on their unique situation.
Thank you. Very good. Lastly, Engineer Lucy, can you tell us a bit about Nairobi? Engineer Lucy, your microphone is mute.
Now you can hear me now?
Yes, I can hear you now. Please go ahead.
Yes, in Nairobi, the situation is almost similar. However, because of the lockdown, we are not having a lot of usage in industrial and commercial water. So a lot of water is going into domestic consumption. We have been told not to disconnect water by executive order. So we are not disconnecting any water. So automatically when you're not disconnecting, the collection is quite poor. So we have continued to supply water as much as possible and make sure that everybody is getting water. And we have been giving water even by tankers. But about the collection is quite poor. The government is coming in to assist with operations and maintenance in purchase of chemicals. And they have also been told that we should not be disconnected from electricity. So the government is assisting in operations and maintenance. But we must say that we are seeing a very difficult period afterwards in collection of the arrears.
Good. Thank you very much. Well, we have the second set of questions. Because of sake of time, we had a question on the masks, but most of you have already responded to that question. So I will jump to the fourth question directly. And the context of the fourth question is being today visibly on the front line. I'm talking about water utilities and sanitation utilities, having to provide services at all costs in difficult and technical and financial conditions. So how do you think the current situation could impact your business in the future? Do you think that in the future, internally, things could change in the management of the company, as well as the perception that the people in the government could have on water and sanitation companies? And for this, I will start with Dr. Clifford Bremer from Ghana.
1 minute.
Thank you very much. It's of course going to things are going to change. Might not be the same as we've been managing the company, the way we manage the company. We believe at Ghana Water Company that habits are going to change. People who didn't take some issues of their hygiene because of COVID have been asked to do it. And so it will now become part of them. And so we believe that demand will be a bit high, and it also will bring onto the company a reason why we have to be more efficient. Because if the challenging times, people are increasing demand and you have fixed production rates, all you can do is to manage your system efficiently. And so we believe that going forward is going to also make sure the company becomes more efficient. It's given us an opportunity to sit with the government and then to be able to explain and narrate some of our operations to them. You can see that they are beginning to appreciate the difficulties and the challenges that we go through in getting water to the consumers. And I believe that going forward, that platform will continue, and now that they understand us properly, the business will also change in our favor to make sure that we get quality water for people. Thank you.
Thank you, sir. Dr. Mahmoud Lutaya.
Thank you, Russia. I think when you look at what we're going through in all these organizations, there's a lot of transformation happening. There are things that we're doing with a lot of time. Right now, we don't have time. We have to do them in a very short time. We're being challenged. The areas that we use not to provide water consistently, but because of this crisis, we're able to do that. We are running with less staff under a very constraining situation. So a lot of things have changed, and I don't think it's going to remain the same. People have tried to appreciate the value of water at all angles, from the customers to even the government. Like I said earlier, some customers are able to pay even without disconnection. So we're talking about business transformation. So most of the things we're doing right now, I believe, are going to become the new normal, like one would say. So we're going to see a lot of transformation. The COVID could act as a catalyst for this transformation. It could, I mean, it's not good to say, but it could have been a blessing in disguise for us to transform the way we operate. So there's that positive side to it.
Thank you. Moses Way from Lilongwe.
Thank you. Certainly this pandemic has taken us unawares, not only us, but I think the world over. We never thought this was going to happen, but it has happened. And certainly this is going to have a lot of impact on our business. Like I've already said, the fact that we are not disconnecting for those that are outstanding water bills means that at a time when all this is gone and over, we shall have difficulties in getting back to where we are supposed to be in collecting the revenue that shall have, whose water shall have been consumed over a period of time. Because in any case, the challenge now is no one can tell when this is going to be over. Yeah, it's there with us, really. We are just hoping that maybe next month, maybe the other month, but we never know how long we are going to be in this situation. So certainly the business is going to be affected. And again, it is high time that as the Water Board, we are thinking that we should come up with a policy, kind of like a policy on disaster preparedness, because this is the disaster and we never prepared for it, really. And today it is COVID-19. We don't know what is going to happen the next day and so forth. So it is high time that as an organization, we think we must put in place a policy for disaster preparedness, even setting up a fund that would cushion us in times like this. Yeah. So in a way, even the way government looks at the whole thing has changed. Everyone now is able to appreciate that water is valuable. We just need to make sure that we invest in infrastructure development, even if it means having infrastructure that would produce more water than needed, because in times like this, that's when the need would come out clearly. Thank you.
Thank you very much, Moses. Professor Amans Kassan.
Thank you very much, Sylvain. Let me start by saying that every crisis is an opportunity. This particular crisis was not foreseen. The opportunity that it has presented to us now is for us to do more thorough emergency preparedness, better risk management, in order for us to be better prepared for things we've never thought about before, firstly. Secondly, I think that one of the learnings that we've acquired is that, interestingly, many staff can work with technology from home. And I think that this uptake of this technology utilization would not have happened had it not have been some crisis that pushed us along the technology adoption curve. Thirdly, I think that we need proper technologies and relevant technologies that can empower people. And then the criticality for me, importantly, the criticality of safe water and sanitation, I believe has come under sharp focus now globally, particularly in developing countries that are lacking in this respect in terms of the SDGs we are all familiar with. And I would like to believe that we will all now move on with a deeper appreciation of water supply and the urgency to overcome the sanitation backlog, so that a lot of these challenges which we have had for many years have just accentuated, they've surfaced under the COVID epidemic. And I'd like to believe that the world will be a better place and that the utilities will be run more efficiently in the future. Thank you.
Thank you very much. Lastly, Engineer Lucy Njambi. Your microphone.
I think that the utilities will change forever from now henceforth, because I think they will be more appreciated. The role of the utility will be more appreciated, because it has been found that the only way that we are going, that the services can be offered is only through the utilities. I think the utility has been doing a very good job, and it has proved that a lot is possible, more than we have thought in the past. Many things can be done. Many things can be done with belief that it can be done, and with much less resources, because we have fewer people in the offices. A lot of things are getting done, and things are moving, So in future, I'm seeing a situation where services will be offered, because not only water for COVID is needed, but we need even water for normal use. And actually, this has been the target during this time, because much as you try to provide water for hand washing, you also need water for drinking. Another very positive thing that we shall have now is that the water cartels will be broken, because it has been possible to actually reach the people directly without the cartels. And there has been a lot of very good responsiveness. So we are seeing a newer world where the water will be able to reach the consumers at a much lower price and cleaner water. And we are seeing a situation where the utility will be able to interact better with the customers. Thank you.
Thank you very much, Lucy. Thank you very much. So now I'm going to go for the last question, but the last question, you want to have all to respond to the question. The last question is related to the African Water Association. And the idea is to know how the AFWA can support you utilities during this health crisis, so that you can continue to provide quality water and sanitation services to the people in a sustainable way. But the question is not only to you, it's only for all the participants. They can respond later on the emails to AFWA to tell us how we can help. So I will only have in the panelists 1 or 2 answers. Those who want to answer this question, you have the word. Professor and Mahmoud, I guess. Professor.
Thank you very much. Very, very quickly, Sylvain. I believe that this is an example. What we're doing right now is a great example of how the African Water Association can promote the sharing of experiences in our continent. Secondly, I think that the sharing of knowledge via research and a lot of projects that are happening, as you know, that AFWA is in the midst of signing an MOU with the Water Research Commission. A lot of people on the chat are asking questions about the presence of the virus in wastewater and sewage. The WRC is going to be leading a study of that sort. I believe that could be a continental study if we really need for it to be put onto that scale, and we can share those findings. So in summary, I think that yes, FOI is on a new path. FOI should help to lead this continent and have its members share with its members so that we can improve the water and sanitation agenda for all, whether COVID was here or COVID was not here. I believe FOI has this role to play. Thank you for the opportunity. Thank you very much. Mahmoud?
Yes, it's a bit similar to what Professor said, and for me, I phrase it in form of there's an African proverb that says, until a lion learns how to write, the story will always glorify the hunter. So this is the time for Africa to start learning to write so that we don't wait for the hunter to be glorified. And what AFWA is doing is what it should be doing. I think sharing the unique solutions that are happening in the different utilities so that we're able to learn from each other and better our continent. That's what AFWA should be doing.
Well, this could be the last word of this session. I'd just like to thank all the participants. We were around 115 at the time. That's very good. And also thank all the panelists for the time that you shared and the experience that you shared during this 1 hour. I would like to announce that the session will be recorded and it will be available in the AFWA website shortly. And all the questions that have been sent during the session, we will pick all the questions. We will then try to see who is focused on the question among the panelists, and we will send you the questions and you will answer the question, and we will post the question on the website so that people that ask questions could have the response of those questions. So this is what I wanted to say. We will also have a short survey that we will launch just now after this session in all the emails that we have for you to give us an idea on how you thought about this session. Well, thank you very much. Thank you again for all the panelists. The session is now about to be closed, and we will have few other sessions next week on water quality, on sewage, on financial aspect of the COVID situation, on water and sanitation utilities. So until then, take care, and I wish you all a lot of protection. Thank you very much.